So we're going to start chapter 6, and chapter 6 are drugs affecting the respiratory system, and it kind of goes naturally with the cardiovascular system. They're tied in together pretty well. So here are two patients that we are looking or want to look at their respiratory system, and the little kitty cat on the left is a real typical look of a shelter kitty. And shelter kittens are notorious for getting these upper respiratory diseases. They sometimes go lower respiratory. There are viruses, and we typically vaccinate for them. So that FVRCP vaccine goes after these viruses that cause the respiratory disease. And they are diseases like feline calicivirus, feline herpes virus, feline viral rhinotracheitis. Um, so most of the diseases that we are giving with that combination vaccine are these upper respiratory diseases. Some of them, the vaccine does not actually protect against completely against the disease. They may get the disease in a milder form, but it definitely will help them. So we like to get these kittens in, hopefully before they get the upper respiratory diseases, and get them vaccinated and protected and keep them away from other cats that may spread this. Really hard in a shelter to maintain control over that. This horse, on the other hand, this is the one time that it's appropriate to put a plastic bag over a horse's nose. And that is when we are looking to uh, have the horse breathe deeply. So when you and I go to the doctor asks us if they're doing an exam of our lungs, hey, take a few deep breaths, and we can't do that with a horse. So what we do, short of you can run the horse around, have someone lunge the horse, or you can simply put on what's called a rebreathing bag. They come in thick plastic like this. My preference was for ones that are more cloth-like because horses are very curious about anything that's sort of crackly and crunchy. Um, so you put this bag over their nose and you have someone listen. You can see this technician or veterinarian is listening to the horse's lungs. And as they exhale carbon dioxide and there's less oxygen in the bag, it starts to make them breathe deeper so that you can hear the lungs better. So that is when it's appropriate to put a plastic bag over a horse's nose. So what are we going to learn in this chapter? We're going to talk about antitussive drugs, and tussive has to do with coughing. So drugs that help with cough. We're going to talk about mucolytics, expectorants, and decongestants, and so you'll know more about what those are at the end of this chapter. We've already talked a little bit about bronchodilation, and so definitely when we want an animal to breathe better, we want their bronchioles to be open, their airways to be open. And then we will talk about these last drugs, and you can recognize many of these names, and how they play a role in respiratory disease treatment. So let's talk about the respiratory system and how it has a natural protective mechanism. So when an animal breathes in something that is irritating to the upper airways, they may sneeze. That's the first line of defense, is just sneezing. And then we can get coughing if that tends to irritate further down in the tracheal area and pharyngeal area. And if you remember, that area is very good at distinguishing between what needs to go down in the esophagus and what needs to go down in the lungs. We've all had the experience of breathing in something that really shouldn't go down there. But for the most part, that area is very good at separating what goes where. When we have an irritant that we're breathing in, mucus is produced, and that's another defense mechanism. We're going to trap dust particles and other things that are irritants and start to try to move them out, whether we um, whether we blow our nose, and an animal will do that. They'll just exhale out and expel things out of their nostrils. And that mucus also is produced down into the trachea and um, and into the large bronchi. And the mucus then is moved upward in the respiratory tree via the mucociliary apparatus. And these are just little cells that have these little cilia, and it moves things up. And this is kind of a cool, it's an actual image of a person who was asked to inhale this radio opaque or this contrast material. And then it is a picture, and this is highly accelerated, but it only took a few minutes, I think it was 10 to 15 minutes, to move the yellow material up the mucociliary apparatus. So if it's working well, we get things out of there fairly quickly. So, and then lastly, we have constriction of the bronchioles. So way down in the lungs, we want to not have things get, close to the capillaries and the small bronchioles. So we'll constrict to keep things out of there. And hopefully, again, it's trapped in the mucus. Now, animals that mucus comes up, and typically it is swallowed and then is expelled through the GI tract. In some cultures in the world, people will actually spit. That's part of what they do, and it is part of clearing things out. So it just kind of depends on the culture you're in, but in some cultures it's very acceptable to spit things out. Sometimes animals will cough things up, but other times the more common thing is if it's a mild amount of mucus, as it just gets into the mouth and swallowed. As gross as that sounds. So what sets off a cough? So we'll have a stimuli. It's going to be in the larynx, trachea, bronchial area, and that will stimulate the afferent nervous system and vagal nerves to stimulate what's called the cough center. So the cough center is in the medulla oblongata. Kind of similar to the vomission center, we have a center that coordinates the coughing muscle movement. So once that is stimulated, then the efferent limb, the motor nerves, start to stimulate the larynx and the lungs and our diaphragm, and we're going to cough things out. So this is a protective mechanism, and we do sometimes want to shut this down, but we'll use what's called an antitussive drug in order to do this. So we want to look at our cough before we consider treating it. And we'll want to look and see, is it a choking cough? And that's usually in the laryngeal, pharyngeal area. Something has hit that area and it's more upper airway, upper respiratory tract. And it probably will resolve on its own, and unless something is caught in there, and that might be a mechanical kind of problem to solve, involving surgery or something like that. And then we have deep cough, and deep cough comes from lower down in the respiratory system, so down from the lungs, originating from the lungs. And that might be an infection. It may just be an irritation that is just self-perpetuating that we need to stop. And so that is where we consider using drugs more for deep cough control. And then also we have to think, is this a productive cough or a non-productive cough? And this kind of goes to that mucus thing and secretions that occur in the lungs. And that's what causes a productive cough. And you can hear a dry cough is usually sort of a hacking sound. A productive cough, it seems like stuff comes up, and sometimes there's gagging and retching with a productive cough. A non-productive cough typically occurs at the beginning of an illness or later on when something is more chronic. As it becomes more chronic, then some of those secretions that occur become dried out with time, and That is called that's called inspissated. That's the word that we use for dried secretions. Inspissated is, it's harder to get that out of the lungs. Animals will really cough and work to get that out. And that occurs if a condition goes on for a long time. Productive is what occurs when we have a very active infection or inflammatory process. And it kind of is the middle ground that happens in the process of a respiratory infection. So we want to listen to that. We typically don't want to suppress a productive cough because that is a protective mechanism. The body is putting out those secretions and we need to get them out. So once it gets to the dry part, we may then, the non-productive part, then we may treat it because then it becomes somewhat just irritating and self-perpetuating. The other way that we get a non-productive cough is if an animal is dehydrated, and if they are not feeling well, they won't always drink enough. And that's why when you get a cough, when you get a cold, the words are, be sure to get plenty of liquids because it's helping clear things out of your lungs. So same thing here. Sometimes we can turn a non-productive cough into a productive cough simply by hydrating the animal. So when are we going to use antitussives? We're going to use them when the cough is no longer useful to the animal and it may be just self-perpetuating. And that's typically when we have a dry, non-productive cough. And we have two ways to suppress coughs. We have centrally active, and so this is also the word is systemically active. This is a drug that's going to go into the animal system and it's going to get to the cough center. Locally active would be things like cough drops. We cannot give those to animals, so we don't use locally active antitussives. We just use the centrally active, the ones that go right to the cough center and suppress the cough. So as I said, we don't want to suppress a productive cough, but a very appropriate use for antitussives is a situation like kennel cough. And kennel cough is caused by Bordetella, bronchosepticum, or the parainfluenza virus and some other viruses. And what happens is it's like a cold, and the animal has to work their way through it. We give them supportive care, but eventually that cough can just be self-perpetuating, and we just have this awful retching cough, or a goose honk cough is another way to describe, especially kennel cough in the early stages. It keeps the owner up, it keeps the pet up, and it can just continue onward, and it's not helping the animal. So that's when we want to treat it. When we don't treat kennel cough, which is also known as tracheobronchitis, we can get a collapsing trachea. So with coughing, it can cause the tracheal rings to collapse because it's just being manipulated too much with the coughing. And eventually we get the tracheal rings collapsing, the insides of the trachea hit each other and cause further irritation and inflammation. And so we want to stop the coughing. We can, it can go on to be bronchitis, so inflammation of the lungs, and then we can get a bacterial bronchitis or pneumonia. And even when we don't treat kennel cough, if it's very persistent, we can get some changes in the heart. And this is because as the lungs become more diseased, we get pulmonary hypertension. So we get high blood pressure in the lungs, and it's difficult for the heart to push blood through the lungs. So that causes hypertrophy or an increased in the muscle mass of the right ventricle of the heart. So, and that is not good. So we want to prevent that problem, cor pulmonale. So we do want to treat things like tracheobronchitis that has gone on past the first couple of days to just calm all of that down. And so that's an appropriate use of an antitussive.